Why are black women more likely to die?
For many black people, there's this fear of going to the doctor.
Would universal health care even the playing field?
Welcome to another episode of Messy Medicine. Here we are, four colleagues just discussing and debating all about our field of medicine, which sometimes can be messy. We may not always agree and we'll have heated debates, but at the end of the day, we're still friends. To my left, Dr. Chris Ibikunle. I have Dr. Jocelyn Slaughter here. And to my right, Nicholas Jones. Good to see you, buddy. And I'm Dr. Mark Jean-Gilles. Today's topic, we're going to talk about healthcare disparities. So let's get started. Dr. Chris, what is healthcare disparity? Please enlighten us.
So healthcare disparity is the differences that we notice in outcomes. How come this person is more able to access healthcare or have health insurance? Health disparity is the outcome certain people is healthier than the other. So there are two different issues, but they're all related. The differences that we're seeing in healthcare outcomes that cannot be explained by genetic differences alone. There's a lot of other factors such as how much money you make, what kind of job you have, what kind of food do you eat, what's your socioeconomic status. So it's a very complex situation. I think the Affordable Care Act has done a lot to improve some of the aspects of healthcare disparity, such as access and healthcare coverage, but we're still a long way from achieving our goal of equitable health for all.
Why are black women 3 times more likely to die during childbirth than white women?
It is a complicated subject with many, many factors. One of the thoughts is that we have a higher rate of hypertension. So if we have more people that are hypertensive, then they may have more hypertensive emergencies. Also is, of course, access. Some people don't have access to a doctor. When I was in residency, some patients couldn't even get insurance because they didn't have the legal documentation to get Medicaid. And so there's a lot of insurance issues that cause it. But one of the things that I think society is more interested in is our physicians listening to black women. When they say something's wrong, are they addressing it? One of the hardest things to fix is a physician's actual bias. And I feel like the better you know your patient, the lower complication rate you have. But if you don't know your patient that well, can't relate to them, you might not believe them when they say, I don't feel good.
Question that I have is, do you think it's more of the socioeconomic status as opposed to the ethnicity? Like if you took a white counterpart that came from the same living conditions and circumstances, do you think they have the same problems?
Well, here's the thing. There are some studies out there that do show that, you know, when minorities are being seen by, say, a minority physician, their outcomes are better. Now, these mainly are with primary care issues like hypertension, diabetes, but you can extrapolate that data and you can probably say, hey, the same can be applied if black women go see a black physician. I may have a Chinese patient. She may not be able to relate to me as well as she could to a Chinese doctor. There's cultural things that are in play.
This is a really near and dear topic to me, is especially black maternal health. Unfortunately, our community, we put way too much pressure on the black woman. Black women are not pampered. We have social stresses that nobody else has in the hospital. Once you get home, during your pregnancy, it's not the same at all.
It depends where you're at. Obviously, when I was training in Philadelphia, we dealt with a lot of black patients there, and so we understood them better. Sometimes here in the suburb areas, I think sometimes it's dismissed, you know, oh, she's really not in labor, she on her phone, and lo and behold, the patient's in labor.
Check her service,
or,
please.
Yes, right,
Check her first.
right.
Check
so
her first.
I think a lot of that has to do with attitudes. There are some studies that show that there may be attitudes and biases in how we interpret what the patients are reporting to us. But there's also other studies that show that blacks and minorities may not be as quick to report a symptom or medical condition as other races. What do you know about that, Chris?
There's a room for improving cultural sensitivity, but we don't have the luxury of having enough Chinese doctors for every Chinese patient. And we don't have the luxury of enough African American doctors for every African American patient. So I think we just have to look at what we can do as an individual. We have to look at what we can improve in our individual responsibility. If you have a diagnosis of high blood pressure, admit it. Take your medication. If you have diabetes, stop eating fast food and high carbohydrate and high sugar food. You have to exercise some degree of individual responsibility so we can get better results while we're trying to fix systemic problems such as healthcare access, coverage, and so on and so forth. I think we can do a little bit better on an individual level towards improving our.
So it's our fault. Instead of asking the patients, can you all improve yourselves? I think we have to help them be able to improve themselves and help them with the access.
And we are, and you're right, we are.
But I mean, you brought up a point about healthcare. Would universal healthcare somewhat even the playing field?
I do believe that it would, just because I think it's been proven in other countries that it has helped to a certain degree.
There's a lot of data that shows that the OECD countries, we're the only one that does not offer some kind of universal health coverage, and we have the worst outcome. We spend more money.
And it's sad because I've had patients come to pregnancy late or not show up because their deductible is high. And you're right, if we can make healthcare more accessible, more affordable, I think these disparities would go a long way in decreasing.
But I think even if we did have universal health care, you still would have a cohort of people who still don't go to the doctor. I have people in my family who have never been to the doctor. Like, I don't know, for many Black people, there's this fear of going to the doctor.
My dad has a ridiculous fear. He's a doctor, so. No, listen. I'm a snitch on him now. He's 73. Never had a colonoscopy.
Wow.
And I have aunts that have never had mammograms.
Right, and he's just like.
Never had a mammogram.
He has a Haitian accent. There's no man that's going to put a thing in my ass. I'm like, damn, but you're a doctor. I'm fine. I see my poop. It's just fine. So that's my pops for you.
And that's part of the problem.
But that's part of the problem. Now, I'm just saying, he's gotten away with it because he's actually doing very, very well.
But let's talk about universal health care. The physician community isn't all that pro universal health care. Some people want it, some people don't. And there are, some people in training that feel like, hey, if we go ahead and make universal health care, then what my earning potential is going to be less, and I'm going through all these student loans, and then next year, I'm not going to make any money.
The problem is, even if we did have universal health care, the reason health care is so expensive has nothing to do with us.
No,
nothing
it
to do
doesn't.
with us. Please, we want y'all to know we are not making money.
It's the politics that are involved in the administration and the hospitals
and the middlemen.
Yeah, it's way too many middlemen.
And I just want to say this, and I want to address the audience. When it comes to healthcare issues and stories we see in the media, it always portrays the doctor as the greedy one. Like, we're the ones making all the money. Now, don't get me wrong. We're doing okay, but we're not making millions of dollars now, right? You'll have CEOs of hospitals who've never seen a patient a day in their life making all this money.
You have to lose your privileges.
When you're paying United Healthcare, Blue Cross Blue Shield, your deductibles, they're fighting us on giving us payments on your behalf. But the hope is that if you had a universal system, right, that you would automatically decrease all these administrative costs. And you should rein in costs, and it should be made more affordable. My only thing is, and I think a lot of doctors would agree, is that, hey, just don't cut reimbursements. And that's the biggest fear of people who are against it. So what would you say to patients, what they can do to help decrease these disparities? And as a physician, what recommendations would you give to your colleagues?
Educate yourself about screening for breast cancer, about screening for colon cancer. If you're a woman, getting your pap smear done. Those health maintenance steps are going to really improve your quality of life and your longevity. And that's what really matters. What we want is for you to be healthy and to live a fruitful and high quality life. And we're ready to help you, but we want you to take the step in seeking better health.
Whether it's your doctor or your dentist, just go and at least get checked up. Even if you don't have insurance, there's free clinics that you can go to. If you don't feel comfortable, I think it's always a good thing to just at least have someone accompany you. Just take an interest in yourself and live a healthier, a better life.
My advice to our fellow colleagues would be this. If you have a patient, no matter what race, and they have a complaint, you need to take it very, very seriously and not dismiss it. So we have to let go of our biases and just take it serious.
Absolutely.
If you do that, you will prevent a lot of bad outcomes. And with that said, that's the end of our show. Thank you for tuning in to another episode of Messy Medicine. If you enjoyed today's show and you have questions or you want us to address other subjects, please let us know so in the comments below. We'll see you for the next episode.